Question number 5, Dr. Parmjeet Parmar.
Thank you, Mr. Speaker. My question is to the Minister of Science and Innovation. What new investment is the government making in health research?
The Honourable Stephen Joyce.
Mr. Speaker, last week, Health Minister Jonathan Coleman and I announced that as part of Budget 2016, the government will increase funding for health research by $97 million over the next 4 years. The annual amount available for health research through the Health Research Council will increase by 56%, up from $77 million this year to $120 million in 2019-20, which will be the biggest increase, Mr. Speaker. The HRC supports research that leads to improved health outcomes and more effective delivery of health care for New Zealanders, and that research brings economic gains for New Zealand.
Mr. Speaker.
Supplementary question, Dr. Parmjeet Parmar.
Thank you, Mr. Speaker. Why is the government investing more in health research?
The Honourable Stephen Joyce.
Mr. Speaker, the government is investing more in health research because it brings a range of benefits, firstly to our health system and to New Zealanders and their health, but also to our wider economy. Health research creates economic benefits by supporting the cost-efficient, cost-effective delivery of services. It generates high-value, knowledge-intensive companies like Pacific Edge, which is now listed on the NZX, which has had support for their research into genetics and epigenetics of cancer. Avalia Immunotherapies, which is a joint venture between the Malaghan Institute and Victoria University, and they are commercialising groundbreaking vaccines for some cancers. And Predict Software, an electronic tool for the prediction of cardiovascular risk.
Mr. Speaker.
Order. Supplementary question, Dr. Parmjeet Parmar.
Thank you, Mr. Speaker. What sort of research will be supported by this increase in funding?
The Honourable Stephen Joyce.
Mr. Speaker, the government's National Statement of Science Investment identifies health research as a priority for investment, and that's why we've committed this very significant increase as part of Budget 2016. It's the largest ever funding increase for health research in this country's history. It will fund more research like the famous Liggins-Howey discovery of preventing lung disease in newborns, which is estimated to have directly saved the lives of about 10,000 New Zealand infants. And the New Zealand National Cot Death Study, which identified changes parents could make to reduce the risk to their baby, which is credited to saving more than 3,000 New Zealand children's lives over 20 years.
Question number 6, the Honourable Annette King.